You can't actually see it, but I promise they're really dry. Hi everyone, my name's Sarah. I'm a junior doctor working near London, and in this video I wanted to talk about the things that I've learnt whilst working in the emergency department during COVID. Now, this year has been incredibly difficult for everybody in all sorts of different ways, and I wanted to share what it's actually been like on the front line working in the hospital and seeing a lot of COVID patients and presentations. A lot of family and friends have reached out to me asking me what it's actually like working in the hospital and what I'm actually seeing day in and day out. It can be incredibly confusing to know what's actually going on when you see one thing in the news, another on social media, and then hear all sorts of other things from relatives and friends from around the country. So I'm planning on making a video of what my day actually looks like in the emergency department to give you a really accurate picture, but I thought I'd share some of the lessons that I've learned over the 2 months that I've worked in the emergency department. And I think that a lot of these translate to life lessons and things that you can apply in your day-to-day life, so hopefully it will be useful for both of us. The first thing that I learned, and I would say perhaps the most important thing, is not to assume COVID. So we have a lot of patients coming into the emergency department with shortness of breath, a cough, fever, feeling dizzy or lightheaded, and just feeling generally unwell. And it's very easy to group these symptoms together and then just assume it's COVID and treat accordingly, but by doing so you can miss very serious life-threatening diagnoses. This can become even more difficult when you've got elderly patients who come in with dementia, multiple comorbidities, so they're very complex patients. Oftentimes they'll be coming from nursing homes or care homes and aren't very independent by themselves and are difficult historians, so that means that it's very difficult to get the full story of what's happened in the last few days and what symptoms they're getting. And while it may very well be COVID, it's very important that you don't miss out other serious conditions. And there's been a lot of cases over the year where people have come in with COVID-sounding symptoms and very serious diagnoses have been missed. So while we are definitely living through a pandemic and there will be lots of COVID patients, we have to remember that there's still going to be the cancer patients, there's going to be the patients with heart attacks and infections and all other sorts of things that aren't necessarily going to be coming in with COVID. So it's important not to fall into that trap. So for example, the other day there was a 97-year-old lady who came in from a care home with shortness of breath and just general symptoms of feeling unwell and not quite herself. It was difficult to get a clear history and it sounded like COVID, but after some discussions with the consultant and just hunting around on the system to find out her previous history, we found out that she'd had previous pulmonary embolisms in the past. So that's when one of the pulmonary arteries in your lungs gets blocked. And it can present very similarly to COVID in the sense that you can get shortness of breath, coughing, chest pain. It is a clinical diagnosis and you've got different scoring systems like the Wells score that you can use to identify how high risk the patient is of having a PE. And we ended up treating her condition as a PE, starting her on the treatment dose medication that she needed and sending her for a scan. And she did have a PE. So the most valuable lesson I learned from that consultant was to think of the most likely diagnoses, but then also think of the most life-threatening ones that you want to definitely rule out. So if somebody comes in with chest pain, for example, yes, it might be the frequent coughing that's causing some chest discomfort and that's due to the COVID, but then it can also be that the person's having a heart attack or has had one in the past. Again, you don't want to miss that. And the way that this translates to general day-to-day life, I think, is making sure you don't assume or jump to conclusions too early. And that can be in your relationships with people, so not assuming something or thinking the worst, but just giving the benefit of the doubt and not jumping to conclusions. And this can also be the case in your personal projects and plans where you've got goals that you want to reach and you're taking some risks. Make sure that you keep a bird's eye view and not have these blinkers on where you focus on what you think is going to happen and miss out some important factors that could be very important. You'll be much better off generally if you don't have those blinkers on. The next thing that I've learned and that I'm still learning is the importance of taking care of yourselves. The emergency department never sleeps. It's like clockwork, there's shift patterns and there's doctors taking over one after the other overnight and over the day. And there's a regular influx of patients coming in, oftentimes more than we can manage. And it's very easy to fall into the trap of thinking that you just need to work faster, harder, more efficiently, and you keep pushing yourself until you get to a point where you burn out or you're not managing patients as well as you should and not providing the quality of care that these patients deserve. On top of that, you may not realize, but wearing FFP3 masks, visors on top, it's incredibly difficult to communicate with a patient, especially elderly patients who are sometimes hard of hearing and can be quite confused in the hospital. hospitals. So oftentimes I find myself speaking very loudly to make myself heard, and I'm also struggling to breathe under the mask, and it gives me regular headaches. So in a nutshell, physically, psychologically, emotionally, it can be incredibly taxing to work in that type of environment. Not to mention what washing your hands 50 million times during the day does to your hands. You can't actually see it, but I promise they're really dry. All that just highlights the importance of taking regular breaks and giving yourself a breather. The ED consultants are incredibly good at making sure that you get your breaks on time, and we're allowed 30 minutes over the 9-hour shift, and we need to make sure that we take that break, have some lunch when we can, and just take a breather before we see the next patient. I think this year has shown a lot of us how important it is to take a break, look after our mental health, and just take a slower pace when we need to. So I think that reflection translates very well to everyday life, and it's not an easy thing. I forget sometimes to take my breaks, and it's way easier said than done. Oftentimes I'll forget and I'm in between patients and I don't really have time to take a break, and I definitely feel it afterwards because I get incredibly tired, and if that builds up day after day, then I'm not going to be at my best and I won't be able to care for patients as I should. So try and make sure that you look after yourself. If you're not looking after yourself, you won't be able to look after anyone else. Another thing I've learned in ED is the importance of teamwork. We literally could not do it by ourselves. Try running a hospital without porters or healthcare assistants. It will not work. Especially during this COVID period, some teams are incredibly stretched thin. There's not enough healthcare assistants, not enough nurses, not enough porters, not enough doctors, and we're all running very low. So it's really important that we stick together and make sure that we're helping each other out. On some days, before we start our shifts, the consultants will run through how many people are working that day, and we'll be told if there's not enough nurses, for example. And on those days, all the doctors need to pitch in, make sure that they're doing the ECGs, taking the bloods, so that the nurses can manage their workload. Otherwise, it's really not manageable at all. And helping out is actually quite a selfish thing, because you may be helping out the nurse to do some blood tests or doing an ECG, or taking a patient to CT instead of the porter. Especially somewhere like the emergency department, favours will be paid back, everybody helps each other out. And it just maintains great relationships where you're looking out for each other. It's really nice to know that people are looking out for you, and it's the little things that really count. So just the other day I was working a late shift and I hadn't eaten anything, and a nurse just silently dropped a chocolate bar next to me while I was working. And it was a tiny thing, but I really appreciated it, and it just reminded me of how important it is to look out for each other and help when you can. And translating this to life generally, I think this year has shown us the importance of helping each other out, because we really can't do it alone. Another thing that working in the emergency department during COVID has highlighted for me is the importance of being proactive. A lot of opportunities do not present themselves to you. You have to go after them. So when we talk about helping people and doing things like bloods and ECGs, I found that just by changing my mindset and thinking, what do I want to learn and what do I want to be better at, it's been really helpful, because then things that I'm doing as a favour for other people, I'm actually using to develop my skills, and that leaves me as a better doctor in the end. And aside from doing obvious favours for my colleagues by doing ECGs and taking blood tests, which helps me maintain my skills, there are so many other situations in the emergency department where I can develop my skill sets and be incredibly useful as well. But you need to be proactive to find these situations. So for example, in the resus department, so that's where the very poorly patients who come into the emergency department get taken to, there are a lot of patients who come in, COVID or not, who are incredibly sick and need immediate attention. And oftentimes the senior doctors will manage these patients, whereas the more junior doctors like myself may deal with the less acute patients. And I found that if my area isn't too busy and I'm not seeing a patient, I'll often go to resus and ask if there's any help that they need. And it's really great for my learning, because I'm put in a situation that I wouldn't typically experience, and I'll help in any way that I can, whether that be assessing the patient, taking their bloods, calling the different specialists and the seniors. And it's a great vantage point, because I can see all the treatments that are being put in place and how the seniors are doing their jobs, and at the same time I'm doing them a favour and being really helpful. And typically the senior doctors won't necessarily ask for the juniors to come and help, so that's something that I proactively do and reap lots of benefits from. And again, as you can see, it's something that's really translatable to general life. Not a lot of opportunities are just given to you. The ones that are usually worth taking are ones that you have to go and grab. So find out what you want, find out what you want to be better at, and actively chase that thing. Finally, what I learn in ED day in and day out with all my patients is the importance of details and the human side of things. As a doctor, it can be quite easy to put your blinkers on and treat the patient as best you can, providing them quality care, and forgetting that there's a human aspect to it. It's the little things like making sure they can charge their phone so that they can call their loved ones, or making sure that they've got a biscuit while they're waiting for the scan. That's the thing that patients remember, and it can be really easy to forget that when you're in a high stress environment. There's so many COVID patients to deal with, and the workload and the stress that we're all feeling. And there's a quote that captures this thought: they may forget what you said, but they will never forget how you made them feel. Especially in the times that we live in, I think it's incredibly important to do those little things for your loved ones around you. Whether that be sending a message to somebody you haven't spoken to in a while, making somebody a cup of coffee, or even talking to your parents. It's the little things that count, and I think that's what makes everything worthwhile. So those are some of the things that I learnt whilst working in the emergency department, and I still have a long way to go, but I hope that was insightful. I would love to hear your reflections, or if you have any questions, in the comments down below. And don't forget to like and subscribe. I will see you in the next video.